Hi, my name is Matam. I'm 22 years old and I was diagnosed with the ALS at 20. This video explains the basics of ALS for anyone who wishes to learn. Human disease made simple, ALS. ALS or amyotrophic lateral sclerosis has several names. You may have heard of it as Lou Gehrig's disease, named after the New York Yankees baseball player. ALS is a form of motor neuron disease, and many people may use the two terms interchangeably. While ALS is considered a rare disease, there are still about 200,000 people living with it around the world. The average age of disease onset is between 58 to 60 years old, and only 1% of patients are under 25. I am a part of this 1%. ALS is also a terminal illness, which means that there is no cure, and most people live 3 to 4 years after their diagnosis. Stephen Hawking, however, the famous physicist, lived 55 years after his diagnosis at 21.
In order to move your muscles, your brain sends a message through neurons, which are relayed to secondary neurons in the spinal cord, which send the message to the targeted muscle. In ALS, there is degeneration of these neurons that send messages to your muscles. This includes the neurons traveling from the brain to the spinal cord, as well as those traveling from the spinal cord to the muscles. Because of this, ALS makes it so that you gradually lose control of all your muscles, and there are a lot of muscles all over your body. This can cause difficulty and loss of ability in simple things such as chewing, talking, holding things, walking, and more. For Amanda, the first symptoms she noticed were a change in her walk, finger twitching, and extreme fatigue. Eventually, patients will be completely paralyzed. The only muscles that are never affected in ALS are those that move your eyes. You can support Amanda by following her journey on Instagram and TikTok. Also, you can support the search for a cure by donating to ALS organizations.